Breast cancer affects 1 in 8 women during their lifetime, a very alarming trend to hear about. But advancements in treatments continue to be made. Patients who need to undergo surgery now have access to the latest, most innovative technology, including Hartford HealthCare's seed localization program. Joining us this morning to talk about it, Dr. Heather King, the Director of Breast Surgery at Hartford Hospital. Dr. King, thanks for being with us, and tell us what the standard approach has been for targeting a tumor during breast surgery.
Good morning, and thanks for having me. So the standard approach for surgery has been where a woman, for a non-palpable finding that needs to be removed in the breast, to have a wire placed or a what's also called a needle localization procedure. So what happens on that day is the patient meets with the radiologist the morning of the surgery, and after being numbed up, a wire is placed in the breast next to the targeted tissue that is needed to be removed.
Now, I have never heard about seed localization. What exactly is this technology, and how does it work?
So the seed localization program, how that works is same thing. If a patient has a non-palpable finding in the breast that can be targeted for removal, a seed is actually placed in the breast, either days, months, or weeks before the surgery. And that equipment sends off a certain signal to a special probe that the surgeon has in the operating room. So once the incision is made in the breast, after the patient's placed to sleep, of course, and then the probe is placed inside the breast tissue, and that gives us an accurate measurement of the distance of where we are from the actual target tissue that needs to be removed. So we're actually able to measure out within millimeters of how much tissue needs to be removed.
And why is this method of treatment so beneficial?
It's beneficial because what we normally have to do right now is patients have to come in early in the morning for the wire to be placed with the radiologist. So we're able to get rid of that early morning start and actually open up more operating room times with the patient and get them in possibly sooner because we don't have to wait for the radiologist.
And I'm sorry, doctor,
I'm sorry. Yeah.
Go ahead.
I was just going to say one other thing that was really important about that is sometimes it can be a little less painful because you're not having a wire, or the visible of a wire coming out of your breast can be a little bit more intimidating to some patients.
Okay. I was going to ask you about any new advancements going on at Hartford HealthCare in your breast surgery program.
Sure. We're always trying to make something better, right? So when we do mastectomies, particularly on patients, there are two types. There are skin-sparing mastectomies and there are nipple-sparing mastectomies. And on the nipple-sparing mastectomies group, if you are a candidate for that, you can actually, at this point, we're able to identify nerves, sensory nerves in the breast, and perform what's called nerve grafting at the time of that surgery, so that patients can start to regain sensation to their nipples and also the skin around the central part of their breast. Because currently with a mastectomy, it's all numb. So that's an added technique we have to offer patients currently.
All right, Dr. King, we appreciate the time and hearing about all the advancements going on at Hartford HealthCare. Thank you so much.